Can intermittent reinforcement and trauma bonds occur in non-romantic relationships? Absolutely, intermittent reinforcement and trauma bonds can occur in non-romantic relationships. Trauma bonding is a psychological phenomenon where a strong emotional attachment forms between a victim and their abuser. This bond is characterized by cycles of abuse and intermittent positive reinforcement. While we often think of trauma bonds in romantic contexts, they are not limited to those relationships. Intermittent reinforcement refers to the unpredictable delivery of rewards, like affection or praise, mixed with negative experiences such as abuse or neglect. This pattern creates a psychological dependency because the unpredictability activates the brain's reward systems, similar to addiction. Victims may crave those occasional positive moments, even when they are experiencing ongoing harm. In non-romantic relationships, trauma bonds can appear in several ways. For instance, in parent-child relationships, unpredictable parenting can lead to trauma bonds. A child may experience harsh discipline but also moments of affection. This inconsistency can cause the child to take on caretaking roles or defend their abusive parent. Friendships can also exhibit trauma bonding. In one-sided friendships, one person may alternate between flattery and criticism, creating crises that requiring rescue. This dynamic can foster trauma bonds through intermittent reinforcement, as the victim may feel a strong attachment despite the negative treatment. Professional relationships can be another area where trauma bonds form. A boss or mentor who mixes praise with humiliation can create dependency. When boundaries are set, retaliation can occur, further complicating the relationship and reinforcing the trauma bond. The core dynamic across these relationships is similar. Cycles of harm and reconciliation, combined with intermittent positive reinforcement, create an attachment that is difficult to break. This attachment is fueled by the brain's response to unpredictability, where the mix of pain and relief can mimic addiction. This can lead to intense loyalty or dependence on the abuser. Recognizing that trauma bonds and intermittent reinforcement can occur beyond romantic relationships is crucial. It helps us understand and address abuse in various social contexts. Awareness of these dynamics can guide therapeutic interventions and support for individuals affected by them, regardless of the relationship type. Understanding these concepts is essential, especially in the context of post-traumatic stress disorder and trauma-informed care. Recognizing trauma bonds in different relationships is vital for effective treatment and recovery. This knowledge empowers individuals to seek help and break free from harmful cycles, promoting healthier relationships in the future.